Okay, so we're looking at a horse here that had the number 8 tooth removed, I think it was about 2 years ago or so. And so we can see on top we only have 5 teeth. So the third tooth is actually missing, starting at the front. So we can see that little space. Now when we come around, we floated this horse about 6 months ago. And we're going to show you guys one of the issues that you want to keep in mind with extracting teeth is that the opposing teeth, especially on a young horse, is going to hyper erupt, and it's going to want to grow into that space, and that can happen very rapidly. So if we look right here on the bottom, you can see how the third tooth back is actually up at least 1/4 of an inch already, and that's just in 6 months. So it's trying to fill in that opposing space on top. And so it's very important to keep balancing these mouths, because the upper teeth are actually all going to shift in and come together, and they'll eventually close that gap. I'll show you guys where that gap is, and it'll actually end up being closed in completely. So I'm going to use a little pointer here. So this is where the space is. And all of these teeth here and the teeth in front of that are actually going to shift and close into that space, as long as this opposing tooth on the bottom isn't acting like a wedge that's keeping those teeth pried apart. So it's very important to do routine occlusal equilibration, not just taking the sharp points off, but actually balancing the mouth, so that eventually this space will be almost completely closed and there won't be any bad long-term effects of pulling the tooth. So here you can see where we've reduced that tooth now. That only just takes a second to grind that down. And now everything is good. And then the upper teeth can keep doing what they need to do to come together.